Hello, everyone. I'm Dr. Shamadeep Pamik, and I'm a medical doctor and international public health specialist. And I work in the Meta Research and Evidence Synthesis Unit of the George Institute for Global Health New Delhi, India. And today I will be talking about the last module, the last unit, which is One Health and Health Policy. So we are this is kind of like a summary of the entire domain of learnings which you have done, but more looking at the practical aspects of what happens in when we are implementing a one health approach in our system and what are the consequences of health policy. And we'll talk a bit on why there is a need for a unified health policy for one health approach being implemented in the nation on a more wider scale.
Two main things which we will be covering in this module. One is the introduction to health policy, and the other is the is understanding political and institutional challenges in implementing One Health and the importance of a unified policy to address the shared health interests of humans and animals. That is understanding what are the challenges uh, in terms of policies to use One Health. So we have three learning objectives. Number one, understand the basics of health policy. Number two is describing health policy triangle and defining its component. And number three is understanding the challenges and facilitators of multisectoral work in One Health approach and the need for unified policy to implement One Health. So we'll start with the first one, which is an introduction to health policy. So before we talk about an introduction to health policy, we need to first know what is policy. So policy has been defined in various ways, and initial definitions were really focused around governments. So it has been defined as a sum total of government action from signals of intent to final outcome. So when the government signals intent to do something, to take some action, to ultimately when the final outcomes are achieved, all of them are considered as a part of policy. But however, there has been other definitions which are more broad, which says not only what the government choose to do, but also what the government choose not to do is policy. However, again, there are even broader definitions, which are principles that govern action directed towards given end. And another definition is an institutionalized proposal to solve a central problem guided by a conception. And one of the things you will note in the last definition by Antonio is that we are talking about a more larger definition, which is not restricted to government alone. This is talking about uh, any institution which is aiming to solve a central problem. And a very important part of it is that it has to be guided by a conception. So these are the various definitions of policies. And a key message to take from this slide actually is that the understanding of policy initially was around government action, then it also expanded to understand what governments choose not to do. And now it's a more broader definition and is applicable to any organization or institution working on a certain problem. So coming to health policy, and essentially anything around health in the policy domain is health policy. But what we really aim to understand is health policy analysis. And again, there are various definitions of it. But I think we'll go with the latest one, which is by Gilson et al. In 2008, which talks about how it is a multidisciplinary approach to policy that aims to explain the interaction between institutions, interests, and ideas in the policy process. So I will just pause a bit to highlight three main things. One is it's multidisciplinary in nature. So it means that it has taken concepts from various disciplines of science, political science, social science, management, a lot of them. Then we talk about interaction between institutions. So these institutions can be anything in nature. This might be government, it might be for-profit institutions, it might be private businesses, it might be non-profit businesses, it might be universities, anything that is an institution. It might even be, say, trade unions or other types of organization which appear in a democracy. The second thing is these institutions are interacting with interests. So everybody has their own interest and their motivations behind. So that is the interaction we are studying with. And the third thing is ideas, which is every group, every institution would have ideas. So, and all of these three things influence policies. And when we try to understand this in a multidisciplinary manner, that's what health policy analysis does. And there are two types of health policy analysis. One is analysis of the policy process. This is kind of more retrospective in nature, when the policy has already been done and we're trying to understand how problems are defined, agendas are set, formulated, and then finally how they're evaluated and implemented. And the other is analysis in and for the policy process. This is more prospective and more engaging in nature, where the analysis is embedded into programs and advocacy which is happening there. And it's more of the use of very analytical techniques, research and advocacy, in trying to define the problems, decision making, evaluating and implementing policies, but all of this happening in and during the policy process. So this is very, very happening on the grounds while the policy is being implemented and developed. So coming to the next concept, which I would like to introduce all of you, is a health policy triangle. Again, this is from Walt and Gilson, and it essentially says that there are three things which are interacting with each other, which forms a part of the health policy triangle. One is context, the second is process, the third is content. And all of these have actors which are working towards it. So what is content? Content is what the policy contains. So it means what are the objectives and aims of the policy, what are the underlying assumptions made, and this might be of various types in terms of resource availability, what people want, what they not want. These assumptions are often made as a part of the policy. The third is values, which is what those who are making the policy believe in, and what is the distributional impact of the policies that is expected and that might happen. So all of these are from very core content of what a policy is, and these are essentially usually in the form of documents which sometimes explicitly mention all of these 4 points, but sometimes they might not too. And then again, these content of the policy happens in a context, and like they don't happen out of nowhere and in a vacuum. So there are various situational factors, cultural factors, structural factors, and there might even be global or transnational factors which is actually leading to the development of the policy. The third thing is the process, which is how the policy is developed, which essentially means why do some issues are reaching the agenda, who is formulating the policy and why, how is the policy implemented, and what makes the policies change. Like there was something happening, why did the policies change? So the interaction of these context, content and process, and of course the actors, is what makes health policy triangle. So this is a very important concept, and it helps us think through how policies are being done and why policies are being done and designed in a certain manner. The next important thing to understand also is that power and policy are inseparable, and which means we need to know what power is. So power is the ability to make decisions. It is the ability to influence others. It is also the ability to make certain issues off the agenda, which is not having them in the agenda at all. And the fourth way of exerting power is to influence and control resources. So there are different types of actors which we talked about, and all of them would have certain types of powers, and some of them might have all of these forms of power. Okay, and they might have various levels, and they operate in the particular context of that scenario, which may and also lead to various types of power changing over time as the policy is being developed and implemented. So when we do policy analysis, power is an integral part of it. So this is something very important to remember and understand, and this is the key message which you get from the slide. The next thing I want to talk about is a bit more of details on power, and this is given by Kevin John's Power Cube. And this is essentially a framework. If you look at it, this is like a very nice cube, and it has three things. One is the levels of power, which is marked as place. So there might be global power, as for example, WHO or United Nations or any of the United Nations bodies. There might be national powers, as for example, national governments or national agencies within any country. And third is local, or which is more like subnational power, which is power that exists in state governments, power that exists in municipalities, in panchayats. So there are these three broad levels of power, and there are spaces of power, which means that these types of power work in different types of spaces. So some types of power work in a closed space, which is like nobody has access to, like it's a very closed net space in which people from outside cannot enter at all. There are some forms of power which is more invited, where there is a group of people who decides who can be invited and who can not be invited. And the third is claimed or created power, which is when a particular actor, who might be an individual and organization, is claiming power or creating power, which might be local, national, and global. And this might claiming or creation of power might happen in various ways. In democracy, engaging with the media, going and talking in public spaces, and protests. These are all forms of claimed or created power which operate. And the third thing is the forms of power. And the forms of power are also important. They might be invisible. Like if you look around, you might not realize that person has power. That is invisible. And there might also be hidden, like these powers exist, but they are hidden. Or it might be very, very visible kind of power, which you can actually see and understand. As for example, a leader of any state or a government or a public agency or a business would have visible power, whereas there might be various kinds of hidden powers which people have, which other actors have, by which they can block implementation of policies or things like that. So the interesting thing and the very valuable part which the Power Cube brings is that when we see the places of power or levels of power, and the space of power and the forms of power, all of these interact with each other, and it helps us to explore their interrelationship. We can think what kind of powers a particular organization has, and see also whether in terms of what level, what space, what form, and also see how they're interacting with other forms of power by different other actors. So it's a very, very valuable tool for visualizing advocacy plans and finding entry points for action. And the reason I bring this concept to you is also to make you realize that when we are doing policy analysis, we are always having some objective, which is to plan or inform advocacy efforts or find entry points for action. So this is where the Power Cube helps in analyzing the thing and helps us visualize the state of power in policy analysis. The next concept we talk about is health policy cycle. So essentially this says that there is first agenda setting, then there is policy formulation, then there is policy adoption, then there is policy implemented, and finally this is evaluated, and this cycle keeps on going on and on. So this is a very heuristic and an ideal way of looking at how health policies are developed. In reality, there are no clear-cut boundaries between them, and you might find yourself in any of these stages. and every relative will be very different in a different manner. Like it's very difficult to make this distinction. But what it helps us understand is it enables organizing our observations and thoughts into a pattern and a cycle. And it's helped us think about solutions and makes our deliberation from a vague problem of policy to more, enables us to think about it more in terms of the solution, which is like which we are wanting to do. So this also helps us to understand that we are not focused exactly on the policy content, like what are the objectives, what does the policy say, but also things about how the policy was developed, what was the process for it. So it helps us think through that. So that is why we need this concept of health policy cycle. And as I said, because when we start using the policy cycle, and because this is a cycle, we understand it. This is not static. This will change over time. And this entire think of health policy analysis is quite complex. So health policy cycle allows us to appreciate the complexity of developing health policy as well as analyzing it.
Multisectoral work in One Health and the need for unified health policy. So this is a more discussion kind of section of the One Health. And by this time, of course, you have seen this figures and this variation in many ways of what One Health is. Okay. But what I want to bring a bit into the discussion here is that there are two other framings which are very similar to One Health and often discussed, and I think it's important to discuss about them in terms of the challenges of One Health also, because they are kind of related to it. These three framings are very similar, and I'm sure you might have heard about it. One is One Health. The second is EcoHealth. Okay, so EcoHealth is very similar to One Health, but it is more looking at the environment-human health interface rather than looking at the intersection of all three. And the third thing is something which is called planetary health. So planetary health, in theory, it encompasses environmental health and also health of other people, but the focus is very human-centric. It kind of wants to say that, okay, we need to protect the earth and optimize for our actions so that humans keep on benefiting it in a sustainable manner. Okay. These are the three framings of it. Both of them are often looks very confusing, but they are very similar, but philosophically not the same. While One Health talks about human health, environment health, and animal health together. Okay, when we talk about eco health, the focus is more philosophically on human and environment health, whereas when we're talking about planetary health, our primary focus is human health and human economic needs, and optimizing others for the purpose of optimizing human health and environment health. It's a very fine philosophical difference when we talk about planetary health. So planetary health means that we want the planet to survive so that humans can benefit, whereas One Health and Eco Health are philosophically saying that all of them have intrinsic value. We want them to survive together. Okay, it's not for the purposes of humans that we are wanting to save environment and animals. So these are the different framings of it. And the reason I brought this up when we talk about policy is that people come to discussions in the policy table with various ideologies and various value systems of their own. None of them are right or wrong, but understanding that these aspects and these closely related terms and the differences between them helps us appreciate what the other person is saying. So these three multisectoral framings are there. Okay, but there are some strong criticisms of One Health approach that has happened, and one of this is while we talk about environmental health, One Health, animal health, and their integration, often what happens is there are three separate kind of programs that are running in parallel without trying to understand the dynamics and interaction between them. Again, there are some programs and research work also which does this dynamics and interaction part really, really well. But many programs or research studies actually are not able to do that. And the systems thinking part, this dynamicity between the components and the interactions between them, as well as what we call that, the dynamicity due to time, like these interactions change over time. I think these are very complex, of course, difficult to do, but One Health as a concept is supposed to look at it together, not just two of them, or just not look at it statically. So understanding the dynamics and interaction between them is very, very important part of any One Health project. But I think more than this is another criticism, which I think is actually something we really need to be cognizant on as a One Health community I work on, is the environment aspect of One Health is ignored. Often, many of the One Health studies do environmental just like a small part as where humans and animals are existing. And the focus is more on human and animal health. And I would maybe like to think about why this happened. And this why this happened is we look at the policy triangle framework and who were the actors. Most of the actors of One Health, people who developed the concept and propagated it and implemented it, are either veterinarians who are veterinary doctors who work on animal health, or clinical medicine and public health doctors who work on human health. So because where they come from, what they hold and value them, while they talk about it as a bigger concept, the environment aspect of One Health is often ignored. So this is something we need to think about. One Health should have all the three components integrating together. Otherwise, it really becomes a challenge in terms of the long-term outcomes we want to achieve. The other thing that has often been said, and it's not necessarily I agree with it, but criticism of One Health is that it is doesn't have equity. That is, people who are most in need, animals who are most in need, are addressed first as a priority. But again, this is not located in principle in approaches. Some critics who have done it, but again, this is a very challenging area of work which needs to be addressed on. But very importantly for nations which are low and middle income in nature, as per the World Bank classification, equity is a very basic principle of any program we do in any sector, because this is the nature of the problems of our country, and we need to think about equity while we are developing and implementing One Health programs too. So there are various challenges of it, but broadly, I have like a long list. I won't read them out. But what binds this long list of challenges implementing One Health, some of which are, if you will realize, is related to the previous slide where I was showing you about what are the criticisms of it. But the common focus of this is multi-sectoral nature of it. Because One Health has human health, One Health has environment health, One Health has animal health, it needs sectors and different government departments, different government ministries, different actors to work together. And again, thinking back, if you think about health policy triangle, the number of actors are huge. If you think about power, all these different actors who are from human, animal, environmental, they have their own sources of power, they have their own values, they want different types of content, and they have different value systems. So there is a lot of deliberation needed. Okay. And a way to address this often is a higher body like a government making a top-down decision making. Okay, but it really becomes a challenge when the program gets implemented, because I was showing you in the cycle when the program gets to the implementation phase, before that comes the adoption. So all the actors still have to adopt it and agree with it at least to certain degrees. So when we talk about addressing these challenges, having a lot of discussions around it is very, very important. The other problem is when you involve a lot of people, lot of government departments, lot of ministries, lot of institutions, is nobody thinks this is mine. Nobody thinks that I am accountable for it. If this doesn't happen, when something goes wrong, we don't know whom to ask. So this is a particularly challenging area. Okay. And but at the same time, that's why it's important to have some nodal bodies. But these nodal bodies should be acceptable to all the actors and stakeholders in the system. But one big challenge why this is not done also is that there is lack of integrated data of burden of disease in humans and animals. A lot of this work is being done in India, but we have scope to do more. So this is something we need to work on. Uh, and there is also a need to develop a cadre of generalists and methodologists who are working on this. And One Health is a long-term game. It needs people who are working across different domains and are able to transfer the skills from human health to animal health to environmental health, and as like leading the process rather than specialists in each leading the process because others do not agree with them. So these are the kind of challenges, not easy to solve. Okay. And again, this is one of this not about just laboratory and surveillance aspect. It is a lot more than that. But having thought about this and understanding this is the nature of the multi-sectoral nature of One Health, which actually is leading to all these challenges in implementing One Health. And of course, one of the things we will want to do is improve and facilitate. We need a unified policy. And the reason for this also is like, what does this unified policy look like? Because if there is no unified policy, all the different components of One Health will move in their own directions, or it will become lopsided. But there is strong need for training in interpersonal skills, which is leadership, human resource management, health diplomacy, and communication for One Health to develop. Now, of course, we need specialists and technical knowledge of human health, animal health, environment health. But without this interpersonal skills being integrated within policies, we can't make them work together. So offering training in these and seeing how newer leadership styles, which are more deliberated, which are more democratic in nature, how we can engage and get people to agree on the broad principles we are working on. And it's very important. And it, of course, means more decentralized and unified funding across government departments, not like every department getting a budget and resulting in a lack of coordination between them. A more unified funding for One Health programs where everything is more decentralized and it's from a bottoms up approach with local communities and district level initiatives happening with government departments, academic institutes, and the people. That's most important. But of course, there should be one government department who is nodal for this multi-sectoral action. Again, just repeating a point I made in the last slide that this person would be accountable for it, and this is from where all the action at the hub could happen. But again, this should probably be in a more decentralized manner at the state or district level rather than at the national level when things become a bit more complex. And the national level will be nodal for the coordination between the states or district level. But there also needs to be more models at decentralized nature. And that is how our health system is also. So it kind of very well fits into the structure of our existing health system. Of course, not needs to be same. Policy, we're talking about policy, so the most important thing is increased political will, sorry. And when we talk about political will, often when these programs are done, I've seen people say that, oh, we want to engage policymakers. So I've done a research or program, and at the end of it, I will organize a dissemination workshop and see, present it to them and hope they will adopt it. and help it scale up, but a more better way of doing it. And in fact, that is not the way of like engaging decision makers after I've done everything is not really a way of doing it, and it should not be done. What should be done is we need to embed policy analysis in the initiatives right from scratch. We need to engage communities and policymakers right from the beginning in helping us co-design the initiative together. If we do that, there is more multi-sectoral approach, there is more deliberation, there is more democratic processes involved, because of which there's more policy adoption, more easier policy implementation, and we rapidly get feedback, and our program is more comprehensive, and we have like a very strong policy part which is figured out. And any problems that are happening, if we have embedded policy analysis, we can make course corrections in the process accordingly. So that is what all I have to say, and thank you very much.